Hi, I'm Ms. Hinojosa Smith, SimLab staff, and I'm going to show you how to use our new Alaris PC pumps. First thing, as with any other piece of equipment, is to turn it on. And our system on button is right there. Now, just like any other piece of electronic equipment, you are going to follow what the screen says. Now, the very first part of the screen is new patient, yes or no. For the most part, you're going to say it is a new patient, so you can start clean, a clean slate. So, yes. Now, the next thing that it says is acute care. While this is a very fancy pump and has many functions, for your purposes, we would like for you to stick to acute care. So you would say yes. Now, you notice that you have A and B, which is channel A and channel B. We are going to provide you with pumps that have both channels, but now you need to channel select if you're only going to use one of them or which one you're going to program first. So in this case, since this is closest to me, I'm going to choose B. So I have channel selected. Now notice that it says select an option. Remember to follow your instructions. So you have guardrail drugs, guardrail IV fluids, and basic infusion. Stick to basic infusion until you get to advanced courses. So I'm going to do basic infusion. And you go to what you are familiar with, which is your rate and your VTBI, or volume to be infused. So for demo purposes, I'm just going to set a rate of 50 and a volume to be infused of 400. However, you have to have your IV tubing in your channel, or it will tell you so. Your IV tubing is going to come in little kits, and it's going to have this little blue protective coating over this very, very soft tubing. Be sure that you remove it so that you have your soft tubing ready to go in. You also have your clamp. Make sure that you clamp it so you're not losing all your IV fluid. Once you take it off, you're going to open from here below, pull up and open. Okay, you're going to put this blue top on the very top of this. It fits right in, and then this blue component inside the blue component, so it's blue on blue. Now you can close it. Now you are ready to program. Now remember that we are going to use channel B, so it says select channel, follow your instructions. So I'm choosing channel B, and remember that we are going to stick to basic infusion. So I choose basic infusion, and I'm at rate and VTBI, volume to be infused. I'm going to go simple for our rate. So obviously that would be in your doctor's orders, but for demo purposes, I'm going to put 50. I have to tell it that I'm doing rate. It highlights dark black. So now I put in my rate, 50, enter. It automatically goes to volume to be infused, VTBI. I'm going to say that I'm going to infuse 400. Enter, and notice that it says press start. So here's my start button, so I am ready to go. And you have programmed primary IV tubing. Now let's say that you are going to hang a piggyback. I happen to have one ready to go, because once again we're demoing the machine, not technique of IV piggybacks. Now, as I'm getting ready, you can hear that there is an alarm going. And so I look at here and it tells me occluded at the patient's side. Well, as I follow my tubing, I see that I forgot to open my clamp. So that's my occlusion. This side is patient side, this side is IV side. So then I'm going to restart, and it goes. Okay, I'm going to attach my IV piggyback. You will follow your instructions for priming your IV piggyback. I'm going to show you how to program it. So at this point, I want to program secondary. Secondary is equivalent to IV piggyback. Okay, so I'm going to pause, And I am going to channel select. And right here on my main screen, you will see that it says secondary. Secondary is for IV Piggybacks. I press it. Now, if you will notice, I have multiple drugs. I do not want to use all these drugs unless your instructor wants you to. So in which case, you're just going to go to basic. I believe that your instructor would prefer that you calculate on your own. Once you do your calculations, you will determine the rate, which I'm going to say for demo purposes, 50. I have to tell it first. Highlights black, 50. Enter. Volume to be infused, 60. Enter. Now notice that it's waiting to be started and it tells you, verify secondary clamp is open, then press start. This is my secondary clamp. It is not open. So I will open it and then I will press start. And it is going. When this is done, it'll switch over automatically to our primary tubing. And so let's just say everything is done, your patient is going home, so we are going to turn it off. Channel select and channel off. Hold it for about 2 to 3 seconds, then let go, and you notice everything powers down. And once again, open from the bottom. Take your tubing out gently. And keep in mind, when this tubing comes out, should you not have disconnected from your patient, it is clamped off so that your patient doesn't get a bolus. That is the safety mechanisms. Get rid of your tubing, close it again, and you are done. And that is a basic instructions on how to use our new Alaris PC pumps. Thank you.